This education video will go over eMD clinical documentation for nursing students. We will begin by access to the flow sheets. Once you've logged into eMD, highlighted your patient, you will click on the tab that says Flow Sheets. Once this tab opens, the first flow sheet that defaults is the Adult Assessment and Intervention. However, we are going to start with the Options panel first. You can see on the left-hand side that you can change the way you view your documentation by changing the date range. This is an important piece if your patient has been here for quite a few days or an extended length of time. So narrow the way that you view the documentation. As I use my scroll bar, towards the middle of this Options panel is an area called the Flow Sheet Selection. It will default to the location in which your patient is. Here it says 2 Tower, and these are the 3 flow sheets we will focus on: your Adult Assessment and Intervention, Intake and Output Record, and the Vital Signs Record. Creating time columns. Within the eMD application, you must tell the computer when you want to document. We're going to choose the Vital Signs Record. By simply clicking on this flow sheet, it will populate. If you notice the gray bar at the top of this flow sheet, I'm going to right-click in this area. There are a few options. I'm going to choose Add Single Time Column. Add Single Time Column equals I want to document now. Here the date and time will populate as real time, which is what we promote our documentation as. However, if you do need to change the time to reflect the actual time you obtained the vital signs or any documentation, you will manually change it and click OK. At the top of the time column that you just created, you'll see the date and time. Every time you add a time column, you must label it so we know who is documenting it at what time. If you right-click, you'll choose the option Edit Text. You must manually type in SN every time that you label your time column. You'll click OK when you're finished. And you'll now notice how it labels your time column. Vital Sign Record Flow Sheet. This is where you will document all of your patient's vital signs, per the unit policy. You can expand or collapse the rows in the flow sheet to view your documentation easier. A little bit about the layout. The blue titles are called parameters. Under each parameter is what is titled an observation, and each observation has a series of pick lists or data entry fields. For the temperature, you will notice that if I left-click into this field, there is a series of hashtags. These do not need to be deleted as I manually enter the vital signs. I can click Enter or Tab or use my mouse to click into the next field. Remember, it's a left click. You will see I chose Oral as my site for my temperature. Clicking in the circle is a single select. If I hit Enter, I can move on to my blood pressure. As long as the parameters are open by using that Expand Collapse Rows, it will move on to the next observation to document to. Here you will see there is a square box as a selection, which is a multi-select. You will notice there are several observations within this flow sheet that can be added for your patient. However, the nurse that is caring for this patient is the only one who can add these parameters. You will focus on your temperature, your blood pressure, your non-invasive, respiratory rate, and heart rate. Again, for the heart rate, if you choose auscultated as the method in which you obtain the heart rate, you then may document to the heart sounds. If you did not and you used a device, please click Cancel and skip this area. There are a few other things you may see on this vital signs record. This includes a height and weight parameter. You may document to this area if your patient has daily weights, but please pay special attention to the pounds versus the kilograms and that you're documenting in the correct area. This will auto-calculate whether it's pounds or kilograms, and then the way that you measured your patient's weight, so standing scale, bed, chair, etc. You will also note that at the bottom of this flow sheet there's an area for drips. This is for nursing only, to document any rate changes in any continuous drips the patient may have. Most importantly, if you look at your documentation, you'll see it's italicized. This means it has not been saved yet. Once you've completed your entry, you want to choose Save on the far right-hand side. This will ensure your documentation has been saved. Intake and output record or flow sheet. Here you would document all of your patient's intake and output. You will simply click on this flow sheet on the left-hand side, find the gray tab, right-click, choose Add Single Time Column, make sure the date and the time are appropriate, right-click on the top of your time column you created, and enter your SN for your time column. The top 3 rows and your yellow and green time columns you will not document to, as these will hold your cumulative totals. As I'm scrolling through this flow sheet, you will notice that all of the patient's continuous IVs, IV piggybacks, and so forth will flow over to this flow sheet, and that is order driven. Under the oral parameter, we're going to start with the patient's intake of liquids. As I left click into this field, I can enter the volume in which the patient consumed. Here the meal percentage, I've chosen 75%, and it's only in either 25, 50, 75, or 100%. I will also need to document whether I assisted the patient with their feeding. Moving down to output, you can see there is a urine output, there's voided mLs, which is anything that we're strictly measuring. Voided count is how many times the patient got up, so not on I's and O's. The same rule will apply to your output parameter, stool ml and stool count. If the patient has any other type of output or parameter that you need to document any type of volume to, you may need to ask your primary RN to add this, as this is not a function that student nurses can do. So if the patient has any type of drain, such as a Jackson Pratt, they will need to add this so you can document the volume appropriately. Remember that your italicized documentation means that it has not been saved yet. And if you notice, your totals will start to accumulate in the first top rows and your yellow and green columns. Remember to save your documentation. You may edit your time column and data in which you've already documented. For example, if I add a single time column and I click OK, however, I needed it to reflect a different time, such as 30 minutes prior when I obtained the vital signs, I can simply click Cancel and it will remove that time column from the flow sheet. This is because I haven't saved any data. Also, if I realize that I might have documented the wrong data, such as the wrong temp on this patient, I can simply left-click in the time column in which I created, remove the current data, and enter the new vital signs or the corrected vital signs. You'll notice that the documentation becomes italicized, and once I save it, it shows a C in the fields in which I edited. This just means I changed the information. The Assessment and Intervention Flow Sheet, or referred to as the ANI. This flow sheet is usually the first flow sheet that populates. This flow sheet is where you're going to document what you see and what you do with your patient. This is the most frequented flow sheet for each patient. You will have your assessment and interventions within each of these parameters. This flow sheet does require you to obtain a co-signer for your documentation, which will most likely be your nursing instructor. And we will go through this towards the end. I can use the Expand Collapse Rows icon to view the parameters a little bit easier. I'm adding a time column as we've done before, editing so I know that it's student nurse who's documenting at that date and time. Remember that a left click is always going to get you into the data field in which you want to document. A right click is going to produce another menu which has other actions. The first parameter I documented to was the treatment refusal. This is where we can document to any type of treatment that the patient does not want. Nursing students will not document in this yellow area. These are assessments or screens that the nurse can only document to. The first parameter is cognitive, perceptual, and neuro. You will also note that there is a WDL, which means within defined limits. If I hover over the blue triangle, it will show me all of the criteria that is in the defined limits. If my patient fits this criteria, I will left-click and simply choose WDL, click OK. It auto-populates the next menu, but I click Cancel and move on. We chart by exception. However, if my patient does not meet all the criteria, I simply will click WDL Accept this time, click OK. Depending on what the exception is, I will cancel out and left-click next to the appropriate exception, such as speech. If my patient has slurred speech, I will just simply click next to that option, click OK, cancel out of the next field, and you will notice what my documentation looks like. Again, we chart by exception. There's no need to document to every line within this flow sheet. There are certain parameters that you will not document to, such as the swallow screen and the Glasgow Coma Scale. For pain, you will need to go through a thorough pain assessment. So if the patient reports pain, you will then move into the next area, which is your pain rating, their acceptable pain level, location, and so forth. You will document to almost all of these line items. You will notice in this pick list that there are several options. There is an addition sign next to each header, which will open a further menu for you to document appropriately. Again, since it's square boxes, it's multi-select for you to document your patient's full assessment of their pain. You will walk through each observation to document the patient's pain. Here we're documenting to quality. You can document to vital signs if it applies to your patient. And then under pain management interventions is where you're going to document how you're going to treat the pain that the patient has. The first three options have to do with medication, such as a single medication modality. You may have just given a Motrin. Multiple medication modality, you maybe gave a Motrin and a Percocet, or you're pre-medicating before any activities. As we move down, you're going to see more yellow, which you're not going to document to. This is the fall and safety. However, right below that is your interventions with your WDL. Each patient is given an appropriate intervention, such as universal, moderate, or high, depending on your patient's score that the nurse has assessed. If we move down to cardiac, you'll see your WDL. This is your normal cardiac parameter that you will document to. Cardiac rhythm will be for the nurse who is interpreting the EKG strips. You will start to see a series of green parameters. You will not document in the green either. This is from the plan of care. The peripheral neurovascular parameter is a little bit tricky. If the patient possibly has edema, you would choose WDL accept, click cancel. The confusing part is that each of the exceptions is actually separated. So you'll see how radial pulse, pedal pulses, and so forth. You'll want to jump down to the edema portion and document by left clicking next to the 1+, 2+, and so forth, and the appropriate area. So your documentation would look like this, where it says WDL accept, and then it's a little bit broken apart. If your patient has any type of stockings or antiembolic interventions, you'll document here. Okay. Again, this flow sheet does auto-populate into the next menu. So if it doesn't apply to your patient, just simply click cancel and it will move you on to the next field. Here's your IV access. The actual WDL is now towards the top of this parameter, so you don't have to search so hard. And basically you will need to document to this one every 4 hours. That's our policy. I want to just point out here that under breath sounds, you'll notice it's separated yet again, but that is the exception portion. So the clear and equal bilateral breath sounds is actually in the WDL. So you would only document there if that's an exception. Again, you'll see that this flow sheet holds a lot of areas that you can document to for your patient. For your GI, there's your WDL, okay, whether it's defined or not. Again, if it's exceptions, you're just going to document to the line that is the exception. So maybe the bowel sounds are hypoactive in the left upper quadrant, right upper quadrant. And again, multi-select, so you can go ahead and document to as many options as you need to. If we move further down the flow sheet, you will see that we get to our genitourinary. If the patient has a catheter, this parameter will auto-populate based on an order for you to document to. If there are any items that need to be documented to that are not found, you need to speak to the primary nurse, as again, they are the only ones who can add those parameters to this flow sheet. Moving down to musculoskeletal, you're going to document to your WDL. There's also extremity movement. And under the interventions for musculoskeletal, you have activity. So if you assisted them with ambulation, if you performed ROM, Under the extremity movement, you can document to active or passive ROM. Here's your assistance with ambulation, if you had to use any assist. And then again, your ROM performed. Document to the ROM performed every time you do this. So as we were going through this flow sheet, you will be documenting a head to toe during your shift, and then you will be revisiting this flow sheet as care occurs. So you document what you do with your patient, or if their condition changes. If you notice, right underneath the Braden scale is your skin WDL. You can document to your patient's skin. Below that is your oral care assessment as it applies to the patient. And then underneath this is your skin intervention. So under hygiene care is your pick list of all the interventions you applied to your patient. So if you did any linen changes, if you provided a bed bath, if you shampooed, and if you required any assistance with this intervention. You have oral care again, any turning and positioning, pressure reduction devices, specialty beds, and so forth. Before you save your data or your assessment, you will need to assign a cosigner, which we will be going over next. Remember, your documentation is italicized until saved. So assigning a cosigner, I usually do at the end, so that I don't forget the necessary steps. You will locate your options panel on the left-hand side and choose Save Options. Open this menu, and you will notice that there's an area that says Cosigners. Once I click into that field, I will need to search for my nurse or my nursing instructor by clicking in the Other option and manually typing in under Care Provider the clinician's name. I will need to physically click on Search to locate them. Once I do, I will click OK, and you will notice that their name populates in that gray box. Then I can click Save. My documentation becomes unitalicized. Most importantly, go back to the left and uncheck the cosigner's name. You can click Save again if you need to. Again, this is only done for the ANI. This concludes the clinical documentation education. Thank you.